Hello everyone, welcome to another exclusive session with Dr. Sushil Kumar Meher. Dr. Sushil has been leading the health IT group at AIIMS New Delhi for the past 3 decades. In this session, we'll discuss artificial intelligence in healthcare. The healthcare industry is experiencing a significant AI boom with the rapid integration of AI technologies into various aspects of healthcare. This surge in AI adoption is driven by the potential for AI to transform healthcare by enhancing patient care, improving efficiency, and reducing costs. So, welcome, sir, and thank you for joining.
Thank you for inviting us such a wonderful topic, AI in healthcare. And today's stage, in all the domains, AI is giving a major edge to come up a new hand to accelerate their business or services or doing a new tools to integrate in their business for the quality of productions, quality of services, quality of manufacturing, everything has gone up. But AI is just such a domain. It is different than any other domains. And when we are putting the AI means, definitely it is giving some extra hand to the doctors as well as the patients. Okay. Today is the year of the, you can say, era of the revolution of IT technology, and AI has giving one of the extra hand to us. Why AI is required? Basically, there is two layers earlier. The first layer, it was the data. Another layer, it was the information. But when the industry has gone up, the new technology has come up, new technology is more affordable, and the communication has gone up in large manner. So in that cases, majority of data we can generate. But that data, it is converted to the information. But when the researchers, they have found that we have a lot of data and information, why you will not develop something it is called the knowledge? From the knowledge, another layer it has come up, it is called knowledge. Okay, from the data and information, it has called to the knowledge. From the knowledge, again they have used the mathematical tools and all other things, which is called AIIMS to get the intelligence. So right now we are in 4 layers: data, information, knowledge, another one is the intelligence. What is the next? The next it is coming up in 2050. It is called super intelligence. So now we come to the healthcare, how AI is playing a major roles. We have found that around more than 45% of the patients which reaching to the hospital, taking the registration, it is registered in a wrong specialty. Because the person they are guiding them, they are not that much of knowledgeable or experienced that guide them to send to a right place to get the treatment. So what it happens when he is going for a wrong specialty, at least another 3 or 4 days is taking late to go to the right discipline. If the technology can help, it is really a big burden which is coming to the hospital right now, because the doctors, those who are seeing the patients, really not belongs to that specialty. So right now we are using the different AI based tools, that is voice bot also, that when will come or when will take appointments, it will ask your symptom. If she's a little bit knowledgeable or she is knowledgeable, it will ask about some of the reports. Based on that, they'll guide that you have to go to this specialty and take the appointment and registrations. This is one of the major release to the patients, where the time is saving, mental agony is saving, and they are more confident that they are going to a right place and getting the treatment. This is the one aspect of that. Second aspect I'm talking about it. AI is playing a major role in oncology. And oncology is already been year to years. It is the patients, they are affected by the cancer, and is going up around 32 to 40% in the urban area. Majority of the hospitals, they have seen that your breast cancer and ovarian cancer, largely it is affected by the females. Early detection is the only solutions where the chances of survival is very high. So that AI and ML will take a major role on it. Right now, there is some tools that has already been in the testing stage, that as per the doctor's recommendations, when the females are reaching around 35 to 40 years, they're supposed to go for a periodic breast and ovarian cancer test. And it is not possible because we do not have that kind of infrastructure in the country. So one project in India, it is already in final step, that already they have developed a thermal scanning bra for the female, and the ASA workers, they'll go to a place, means most of the ASA workers, they work in the rural area. They'll take the basic clinical data from the patients or anybody, they have some symptom, and it's a periodic checking here. And if they found that something is wrong, then they'll ask her to use this bra. They'll use that bra. The bra is connected with the one cable to their mobile. So there is a thermal scanning, it will go through it. From the thermal scanning, the data will transfer to the mobile, and there is a lightweighted AI tools is available. It can see it, it will look into it, it will process it, that image, and they can suggest that whether he has to go for the another medication process or not. So it has observed that more than 80% cases, it is accuracy, the data is showing very accurately. So this is the one cases what we have. It is a one thing, it is going to be successful, because mammograms, it is available in the urban area, in rural area. The issue is that because of this disease, nobody is discussing with them. If the patient is facing this disease also, she unable to discuss with anybody. The ASA worker, they are female, they are talking female to female, and it is confidentiality is there because she has to wear the bra in a closed room. So this is the one of the projects. It is successfully, it is going to be implemented very soon. Now they are talking in the production stage, how it can be product and how it will be, how it will come to the market. This is the one aspect of that. Another strategy means the AI. Again, it is breast cancer and ovarian cancer. The data which has been collected in Indian origin data, and which is already been in the final step to get a model who can predict early cancer, early detections, and it will tell you that how to get the treatment, what kind of treatment it will suit to the patients. It is totally a personalized healthcare systems. It is already in the process. So these things, it is very largely people are going through it. Second part is that we have a lot of IoT devices which is available in the market. Some are there is you can say the you have small ear device, smart wristbands, smart watches, even smart rings, smart patches also, smart garments, smart belts, smart eyeglasses, smart footwear. All are it is available. It is integrated with the mobile, with with internet protocols. So let's take you, if you have some hypertension, your cholesterol level is very high, your triglycerides is also very high, your BP is not controllable. If anything happens, these are the some of the equipments which are available. Your wristband, it will generate the data and it is connected with your mobiles. And there is some agency, they are providing the services, this kind of services. And that AI tools, they can predict it that he is going to have a MI, mean heart attack. So that alert will come up and immediately the patient has to go for the medications as per the doctor prescriptions. So if you see everywhere, we talk about the golden hours. In heart attack also, the golden hours, it is been used properly, the life can be saved. So these are the things largely people are using in the country. If we talk about another, mostly the means AI people are using the cancer as well as the reporting. Okay, there are two aspects if you ask me to tell about it. One is that we in AIIMS we are getting large scale of samples and how to report it. And reporting is a big challenge because you have a limited manpower. The scale of reporting is very high. So we have some tools which can do automatically reporting, which is not required to seen by the doctors. So that the load it will go down. So there is one analytic program, it is available, and that analytic programs, it will indicate you that this sample is not required to be authenticated, because when any reporting has to be done, it will be seen by the doctor and the report has to be approved by the doctor. Then it will go to the physician or clinician for the final reporting. So in these cases, if this can be reduced, then we can do more tests, more accurate manner. Another one is there's one of the miracles it has come up in radiology. In radiology, what it happens, we are very limited radiologist, and to reporting the CT, MRI, PET scan or mammograph, it takes time. Majority of the places, 24 hours to more than you can say even 6 to 7 days it takes for reporting. So many people, they are using AI tools. Majority reports which is not been required to be reported because it is normal, automatically it is detected by the AI tools and it is reported normal. Some of the tools, it will identify that last time what reporting has been done, right now what changes is done. So it is very easy for the AI tool to detect that one and report that one. Rest are same what it is earlier it was there. So in this way, the radiology reporting systems, it has been more in use to reporting through AI tools. These are the basic practices it is going on right now, but still we are in the beginning of the using of AI in healthcare. Healthcare is something different than any other domains already I have told you, because if you are missing one single report also, it is not acceptable to the anyone. So that's why people just taking baby step to use the AI in healthcare. Thank you.
Yes. So recently, AIIMS-Delhi in August, they it announced extending invitations to collaborate with IITs and IIM in an effort to establish a joint research institute dedicated to AI and clinical trials. So, what are the key strategies for implementing these technologies in healthcare delivery?
See, already I have told you. Right now, we have it is the beginning. Okay, definitely. Already, IIT Delhi has the MOU with AIIMS. Without MOU, you can't do it because patient data is very confidential. You have to keep it. So you have to make them protect. So you're supposed to have a partner which is you have the confidence, has the capability, and has the um, uh, memorandum of understanding has to be signed. In these cases, in these cases they can go for it. So right now, for IIT Delhi, triple IT also already in the process. Many projects is going through the triple IT also, which has been developing a different tools to predictions. One project is that uh, the baby which been born and transferred to the neonatal ward. Okay, then we want to predict that what kind of infections supposed to be faced by the baby. So this is one of the project has been developed by triple IT, and it is a PhD work of a student, and already it is implemented. It is already been implemented. So first of all, AIMS is looking towards the people, those who have already MOU with them. After that, different specialty people, they can make a team and make a project, get the funding from the different agencies, and implement it. So these things are on the process and going on.
Okay, so AI is definitely a game changer and it holds great promise in diagnostics as well, like you said. But it also brings challenges related to data privacy, regulatory compliance, and the ethical use of AI in clinical decision making. So, talking about privacy, in the next episode, we'll discuss cybercrime and how AIMS is ensuring cybersecurity.
Sure,
So,
definitely,
thank you
yeah.
so much, sir. Thank you for joining. Thank you.
Thank you.